Okay, let's dive into this. What if the very things you're taking to feel better are, well, secretly working against you? Welcome to today's Explainer. We're going to unpack a pretty fascinating medical mystery. And the wild part? It might be hiding in plain sight right inside your own home. We're looking at everyday medications and the totally hidden threats they can pose to senior heart health. Seriously, what if your own medicine cabinet is quietly straining your heart? For millions of older adults, this is a lot more real than they think. You see, as we age, our bodies fundamentally change how they process medications. It's just a fact of life. The liver kind of slows down its filtering process, kidney function naturally shifts, and even our overall body composition changes. Because of all this, a daily pill that was completely harmless a few years ago, it can suddenly start affecting your heart in some highly unexpected ways. But the real danger here is how easily we brush off the early warning signs. You know the ones: unusual fatigue, feeling winded just walking up the stairs, or maybe waking up with swollen ankles. It is incredibly easy to just dismiss these things and think, oh well, I'm just getting older. But the stark reality? These aren't necessarily just signs of normal aging. They could actually be hidden medication side effects that are quietly taxing your cardiovascular system.
All of this leads to what medical professionals call the perfect storm. As we get older, our hearts naturally get more sensitive to changes, things like blood pressure, fluid balance, and internal electrical signals. And at the exact same time, older adults usually start seeing multiple independent doctors. You've got your primary care doc, a cardiologist, maybe a rheumatologist. If these doctors are prescribing medications independently without a completely unified, big-picture view of your health, well, taking the right medication for too long or in the wrong combination suddenly becomes incredibly dangerous.
Which brings us to a really crucial number, 7. Drawing on the work of Dr. Alex Carter, researchers identified exactly 7 common medications that might be silently damaging an older heart. And honestly, the most surprising part is that some of these are so common, so everyday, that you might literally be taking them every single week without giving it a second thought. So, let's open up that medicine cabinet and look at our prime suspects.
First up, we've got NSAIDs, that's non-steroidal anti-inflammatory drugs, basically your everyday over-the-counter pain relievers like ibuprofen and naproxen. Millions of us rely on these to manage arthritis, a bad back, or just everyday aches and pains. Let's be honest, it's so easy to just pop an ibuprofen when your knee acts up, right? But we absolutely need to dispel a major myth right now. Just because a medication is over-the-counter definitely does not mean it's risk-free.
Here's the hidden impact. NSAIDs actually cause your body to retain sodium and water, which directly cranks up your blood pressure. On top of that, they can reduce blood flow to the kidneys, which just makes that fluid retention even worse. All of this puts a heavy, completely invisible weight on a heart that really shouldn't be working so hard. So for someone who already has existing heart disease, high blood pressure, or heart failure, taking these everyday painkillers regularly, it becomes a really risky situation.
Okay, next up is another absolute staple, especially in winter: decongestants, the kind you find in cold and flu remedies. If you've ever grabbed a combination cold medicine, you've probably taken ingredients like pseudoephedrine or phenylephrine. We take them just to push through a miserable cold. And honestly, we almost never remember to even tell our doctors about them because they just seem like these minor temporary fixes.
But here's what they're actually doing inside your body. They don't just magically target a stuffy nose. Nope. They work by narrowing your blood vessels to reduce that nasal congestion. But they do it systemically, meaning they narrow blood vessels everywhere. This shoots up your blood pressure and raises your overall heart rate throughout your entire body. If you're an older adult dealing with hypertension, arrhythmias, or coronary artery disease, even a super short course of these decongestants can create severe issues.
Moving from the pharmacy aisle over to the prescription pad, we find proton pump inhibitors, usually just called PPIs. These are incredibly common meds prescribed for acid reflux and heartburn. And anyone who suffers from severe heartburn knows how awful it is, so finding relief is a huge deal. Now, these medications are fantastic when used appropriately to heal the stomach, but it's the long-term unmonitored use that we really need to pay attention to.
And this is fascinating because it perfectly shows just how interconnected our bodies are. Long-term use of PPIs has been linked in some studies to lower magnesium levels in the body over time. Why does that matter? Well, magnesium is absolutely critical for the heart's electrical system, so lower levels can directly increase the risk of irregular heart rhythms. It's just a striking reminder of how a pill designed to help your stomach can completely unintentionally disrupt the precise electrical timing of your heart.
All right, here is one that almost always catches people completely off guard:
antibiotics, specifically certain classes known as macrolides and fluoroquinolones. We usually think of antibiotics as quick, simple fixes, right? They go in, they fight the infection, and they leave. But for seniors, the story is quite a bit more complex.
Now, what's really interesting about this is how these specific drugs uniquely disrupt heart rhythms. These medications can actually alter the electrical activity of the heart, prolonging what cardiologists call the QT interval. For some people, especially older adults with existing heart conditions or folks taking a bunch of other meds, this prolonged interval significantly increases the risk of dangerous, life-threatening arrhythmias. The risk isn't the same for everyone, for sure, but it perfectly highlights exactly why your doctor needs to know every single medication you're on before they prescribe a new antibiotic.
Moving on to a real heavy hitter, corticosteroids, like prednisone. Now let's be absolutely clear here. These drugs can be truly life-saving for conditions like severe inflammation, autoimmune diseases, and asthma. They are incredibly powerful, totally necessary tools. But when they're used long-term, they carry severe, unintended consequences that can just sneak right up on you.
Long-term steroid use basically creates this tough trifecta. It raises blood pressure, it spikes blood sugar, and it causes the body to retain severe amounts of fluid. So an older adult taking steroids for a few months might start noticing heavy swelling in their legs, maybe some sudden weight gain, or feeling a lot more short of breath. And the tragedy is, patients so often falsely assume, oh, it's just the inevitable signs of getting older, rather than recognizing them as the hidden strain of a medication putting intense stress on their heart.
Here's another critical area that requires a really delicate balance: older diabetes medications. Now, I want to pause right here and emphasize that managing your blood sugar remains absolutely important for your heart health. Nothing about this explainer is suggesting you should ignore your diabetes management. Not at all. However, some of the older diabetes drugs have been specifically linked to fluid retention, which can actually worsen heart failure in susceptible individuals. The big takeaway here is definitely not to stop taking your medication. Please don't do that. Rather, use regular medication reviews with your healthcare provider to look into newer, safer options. Today's newer diabetes meds are incredibly advanced, and some of them may even offer additional built-in protective benefits for your heart.
Finally, we have to look at the energy boosters. This is a broad umbrella that includes prescription stimulants, high-dose caffeine supplements, and over-the-counter weight loss products.
Look, it's so easy to just grab an energy shot at the gas station to power through a long afternoon, but just because these products are sold without a prescription does not mean they're risk-free for an aging body. They artificially spike your heart rate, they shoot up your blood pressure, and they can interact incredibly dangerously with the prescription medications you're already taking. They create this immense, totally unnecessary strain on an older heart that is already working hard enough just to keep everything in balance.
So, the crucial point is this: if you take absolutely nothing else away from today, remember to never stop a prescribed medication without speaking to your healthcare provider first. We've spent all this time looking at hidden threats, sure, but the entire goal of this explainer is awareness, not fear. I literally cannot stress this enough. Abruptly stopping a prescribed medication on your own can sometimes be far more dangerous than just continuing it.
Instead of stopping, let's build a game plan. First, as we just said, keep taking your meds until you actually talk to a doctor. Second, keep a meticulously updated list of every single thing you take. I mean everything: vitamins, supplements, those over-the-counter cold meds, and bring it to every single appointment. Third, ask your doctor or pharmacist for a formal yearly medication review to spot any dangerous interactions. Fourth, pay close attention to subtle body changes, like new fatigue or ankle swelling. Don't just write them off as aging. And lastly, try to use just one single pharmacy for everything. That way your pharmacist can spot potential interactions before they ever become serious problems. These are small changes, but they make a powerful difference.
Which leaves us with one final question for you. How will you protect your heart today? Your heart has worked tirelessly for you for decades, and it absolutely deserves your protection. Being informed is honestly the best tool we have for healthy aging. If you found this explainer valuable, please share it with someone you care about, because having the right information at the exact right time, well, that could help protect a heart for years to come.